Hello, dear colleagues and students. Warmly greeting from Tiannan. It's my great pleasure to meet you in this special period. Let me take this opportunity to thank the Solid Exceed project to give me this opportunity to know you, to communicate with you. Today, I will introduce drug addiction treatment and rehabilitation in China. First, I would like to introduce myself. I'm Lin Zhao, professor of psychiatry at Shanghai Mental Health Center, affiliated to Shanghai Jiao Zhong University School of Medicine. My major is on addiction medicine. My work including clinical service, teaching PhD students, and also do research on addiction medicine. I'm happy that I have been working with UNODC and WHO on several international important projects. I'm a member of UNODC informal scientific networks. So each year I will go to UN, but this year I cannot go in because the COVID-19 pandemic. I'm also one member of International Advisor Group and Field Study Coordinating Group of ICD-11 mental behavior disease for WHO, and I am happy that I have lead the field study of ICD-11 MBD in China. I also working as national experts on addiction. For example, I'm the vice president of Chinese Association on Drug Abuse Prevention and Treatment. We call that CADAP. This is a professional associations. I have worked on more than 10 national and international projects. And later on, I will introduce some of that. I hope you can, you have interest on that. And or I also have published many scientific articles in international peer-reviewed journals. And also I work as associate editor for addiction and International Journal of Mental Health and Addiction, also working and other journals as reviewers, and we also have our own journal as the name is General Psychiatry. I'm the associate editor. So I hope you can support us to expand your scientific work. Okay, today my talk is focused on drug addiction treatment and rehabilitation in China. The outlines are, first, I would like to introduce drug abuse and drug control and related policies in our country. And then I will talk about the drug abuse treatment and rehabilitation in China. Last, I hope you are interested to know that I will talk about some of our group, what we are doing and where we are going to go. Okay, so first, I would like to talk about the drug abuse situations in China. Like in other countries, drug abuse is a worldwide public health problem. Although the growth rating of drug users in China has been slowed down, but the drug user number is still very high. According to the official number, the active drug users are 2 million, more than 2 million right now in China. The most used drugs are methamphetamine, heroin, and ketamine. In recent 10 years, you can see the traditional drugs like heroin is become less popular, but the synthetic drugs such as methamphetamine, we call that amphetamine type stimulus is increasing rapidly. According to the numbers, more than 8% of newly discovered drug users in China are use ITS. Among the drug users, the majority are younger people, which there are 35 years older. So the most young people who use drugs, and those are function, productivity, so it have a very huge public health consequence in the society. Another issue here is new psychoactive substance, or MPS is increasing in China also in recent years. MPS is often mixed with other drugs for sale and is abused mainly in European or American countries previously, but in recent years, MPS is becoming more and more common in China. We found 170 new psychoactive substances here, including fentanyl, which caused the opium crisis in US. So the full class of fentanyl has been included in the regulation since May 2019. Like in your countries and other countries, China also attaches great importance on drug control. The drug control law of People's Republic of China is released in 2008. In the drug control law, there are 3 main drug abuse rehabilitation modalities, including compulsory, voluntary, and community drug rehabilitation modalities. Also, drug control or drug use prevention is addressed in many other regulations or projects. For example, the planning of Health China Plan 2030, it is stressed that should be reducing unsafe sexual behavior and drug harm. Finally, in the program for construction of social psychological service system just released in the end of 2018, it stressed that all drug addicts, even neither either they come from compulsory treatment center or community or voluntary, they should provide psychological service in the community. It is expected that more than 6% of the addicts should be provided psychological service by the end of 2003. So all these policies suggest that the drug users or drug dependent patients should be get treatment and help to support them rehabilitation. In China, like in your country, drug dependence was regarded as chronic disease. So the individuals with drug dependence should be treated. Patients are encouraged to voluntary treatment, and even in the compulsory drug rehabilitation center, they should have clinicians to provide treatment. We have a lot of collaborations with compulsory treatment and rehabilitations because they need to collaborate with us to develop new rehabilitation method to help their patients. And in our country, we stress that treatment should be available to all individuals with drug dependence, even though they are in the prison or in detention institutions. Also, social support should be offered to the drug dependent patients in community. So we have community rehabilitation institutions in China, and in the community, it is regulated that discrimination are prohibited, and all parties are encouraged to support the individuals to return to their normal life. The drug rehabilitation in China, there are three main methods: voluntary, community rehabilitation, and compulsory detoxification. Also, methadone maintenance treatment and other measures should be working together, and they have complementary advantages and work together to provide better service to all patients based on their individual needs. Drug rehabilitation is a very important issue in China. So in 2008, Chinese government launched a drug rehabilitation project. We call that 831 project. So it is encouraged that all the drug addicts should receive rehabilitation. So this is a number of the patients received rehabilitation. So you can see there's a lot of patients during 2007 to 2019. Many patients accept drug community drug rehabilitation, and there are a lot of community drug rehabilitation centers. So this center is located in the community. So we have 39,000 community drug rehabilitation institutions. Also, there are many social workers working in this in community drug rehabilitation centers. We have 106,000 social workers working in the community. So there's a lot of professionals working with drug addicts, so help them to get rehabilitated. So concern the compulsory treatment center. Compulsory treatment center is a long-term resident rehabilitation center. People or drug addicts, if they are found by the system, they will send to the compulsory treatment center for 2 years to get the rehabilitation. So during the rehabilitation center, they set up a staged and related areas for different functions. For example, physical detoxification area, educational adaptation area, rehabilitation area, and re-enter society area. So during these different areas, they have different functions. And also, we during the rehabilitation center, they working with other professionals to help the patients to get rehabilitated, such as they can get the service from medical center, from addiction centers to help them and provide medical service, or work with other institutions together. For the voluntary treatment, Mesatone maintenance treatment is one of the most popular service for the opium users. There are almost 800 MMT clinics across China, and each year there are 100 until the end of 2017. There are 160,000 patients, and the maintenance rate is quite high. About 78% of the patients are remained in the treatment. In China, we have more than 300 voluntary medical institutions which provide detoxifications, and there are 600,000 individuals received the outpatient treatment in China. And the main two voluntary drug rehabilitation service is MMT and voluntary detoxification medical institutions. So MMT is introduced in China in 2004 as a method to reduce drug-related harm such as AIDS and STD. Also, the Chinese government to encourage the setup of voluntary treatment in general, medical hospitals and other specialty hospitals, so to provide the needed service to the individuals with drug dependence. This is a map showed that in China, almost in every province, covering like 29 provinces, there are 773 Mesotone maintenance clinics. You can see that the coverage is worldwide in China. And also, the MMT has very positive effectiveness in HIV province. As I told before, that the MMT is introduced as HIV province. So you can see the rates of HIV infection in MMT patients is very low. It's only 0.03% in 2008. So it is sure that the MMT already prevented 17,000 new HIV infections, and also reduce the consumptions of heroin and prevented many drug traffickings, which is very successful. For the STD and AIDS infection prevention, you can see the method of infection is before 2005, the infection through infection is 44%, but in 2015, the transmission through injection is decreased to less than 5%, which means it is very effective to prevent HIV infection. Okay, this is the first part of my talk. We know from this part the drug abuse situation in China, and we know the related policy of drug control in China. So you get some information about that. There are many similarities with your country. Next, I will introduce the specific treatment modalities and what's the specialty rehabilitations in China. Okay, so we'll see you soon. Thank you for your attention.